My name is Prachi, and I'm currently doing a project for Calgary Immigrant Women's Association's Change Leaders program. My project is on female reproductive health and cervical cancer awareness. One of the things that inspired me to do this project is, despite reproductive health being something that has significant impact in all facets of our lives, it's something that's not very talked about. Another part of my project is the cervical cancer and its awareness. It's one of the most common cancers occurring globally, and one of the most interesting part of it is that it is preventable cancer, which meaning that if we take the right preventive measures, it's something that can be stopped and save so many lives. So that's my project, and I have made like a video podcast and an art-based workshop in collaboration with Center for Sexuality. I hope it goes great.
It's always the most important thing is to create a safe place that people feel like they can ask their questions. So it's really about setting up an opportunity for people to recognize that you respect them, that you respect their confidentiality, their privacy, where they are in their life and in the world. And so I think that there's lots of different ways for people to get information and lots of places to get information, but it's really about the importance of women being able to access information in their own languages, if possible. Or if they don't read their first language, how are we providing information in a way that is accessible for folks? Whether it's written information, whether it's images and pictures and diagrams and an opportunity to talk to someone about the information that they have or information that they maybe misunderstand. And so we want people to be proactive. We want preventative medicine. So it is so important for us to make sure that young women are getting the information before they need to have a pap test, before they become sexually active, so that they already have the language, they have the knowledge set around how do you protect yourself from cervical cancer, because there are steps there that women can do and people can do.
So what is the cervical cancer? It is basically a cancer which started in the cervix. Initially, it's silent and not shows accurately, but later it can turn into the cancer as well. So the main cause which lead to the cervical cancer is a human papilloma virus. So for the protection and early detection, there are some tests which we called the pap test screening. Sometimes few women feel more uncomfortable, but I believe it is not a painful, and it is just a small procedure and it takes just a minute, and after that everything will be settled down. Having the screening test like pap smear we do, because the cervical cancer is not happening over a night. It is a long process. It takes years to develop. So we have the vaccination against human papillomavirus as well, which is very important to get early, and it will reduce the risk of having the cervical cancer as well.
The human papillomavirus can live in any body, so not just women's bodies, and it doesn't just cause cervical cancer, it can also cause penile cancer, so cancers of the penis as well. And so it does impact men and boys.
HPV, which is called the human papillomavirus vaccine, so everyone can get. To be honest, all the boys, all the girls, so it is started the vaccination from 9 to 12 years old, usually in the high schools. But in case if somebody didn't get it at the age of 9 to 12, so even the peoples most of the time they can get up to the age of the 26. And in some special cases, even the people up to age of the 45, they can get this vaccination as well. So it will be protection from all kinds of the cancers which caused by the HPV. It's a combination of screening, it's a combination of vaccination and awareness which can make it preventable. We could not wait for the symptoms, because when the symptoms appear at that time, the cancer already gets worse and it is at the advanced stage.
You can tell someone has an STI just by looking at them.
No. Absolutely not. And the fascinating part about STIs is that the most common symptom is no symptom at all. Because people can have STIs for long periods of time sometimes months, sometimes years with no symptoms. And so a symptom is a nice to have, but it isn't a for sure thing. And so there's no way for us to look at someone's body and know they have a sexually transmitted infection.
You cannot get a sexually transmitted infection from oral or anal sex.
Yeah, that's a really big misconception for sure. And the reality is that bacteria, viruses, and parasites, which are 3 different categories that STIs can fall under, they love our bodies. There's a reason why they do well. And the things that they love about our bodies is that we have warm, dark, moist areas. And those are all of those body parts and body openings. The sexual activities that people decide to engage in, for whatever reason they decide to engage in them, the activities are fine. It's really just about understanding that body openings, coming in contact with body parts, that there are things that are important to protect against. And that's what we're talking about. We're not talking about shaming the activities that people want to do. It's just about what kind of things do you need to do to make the best opportunities for no STIs.
Yeah, some people think about that, like only the women who are sexually active only get the cervical cancer, but it is not true, to be honest. Cervical cancer is basically caused by the human papillomavirus, so which is transferred to the others through not only the sexual contact, it is from skin to skin as well.
One of the major concept that people have is that once someone gets an HIV, it's like the end for everything.
Right. Well, and that might have been true 30 years ago, before we really understood what the virus was or how it worked in the body or how it was transmitted. And today, having a positive HIV test is absolutely not necessarily a hardship for somebody moving forward. Again, it's about managing the health, using the medication. And the medications today are so good that what happens is if somebody has HIV, the medication keeps the virus so low in their body that it's not detectable. So we test and we don't see the virus because the medications work so well. And so what that means is you can't give the HIV virus to a partner. When it was first discovered, was incorrectly labeled as a gay disease, and then incorrectly also labeled as only impacting men. What happened was women got left out of that conversation, even though women were dying of AIDS in the 80s, just like gay men were. Well, and I wonder too about women in community and thinking about community leaders and women as leaders. And so often working in sexual health, I hear, oh, we don't talk about this, or this isn't something, but it is. Women do talk about this. They talk about having babies. They talk about planning their children. They talk about family planning. Women in leadership positions within their communities can really be such powerful voices for the sexual well-being and health in community. But I think that there's a real desire in community to have the language, to know how to talk about it. So often I hear from adults and women and parents who are new parents say, I want to do better than my parents did. I want to do differently than my parents did, but I don't know how. And how do we as women stop scaring each other, stop shrouding the information in fear and shame, because those are the things that prevent us, all people, from accessing healthcare, from asking the question. There's that misconception around lots of things being dirty. I think about acne even in puberty, right? It's like, oh yes, you have pimples because your skin is dirty. That's not how that works. Viruses and bacteria and parasites, it's really about how do we keep them off of us, as opposed to how do we wash them off of us. once we have them. That's not how that works either. And so no amount of washing or cleanliness protects from or gets rid of a sexually transmitted infection. That's not what that is. It's like getting a cold. It's not that you're not a clean person. You touched something and you touched your face and now you have a cold. Sexuality is still so stigmatized and sexual health is so stigmatized that it's easy to say, oh, I have to stay home today because I have a cold. But to tell your boss, I have to stay home today because I have a really terrible genital herpes outbreak. Nobody says that.
Nobody says that.
Right? And so I think it's really just so important for women to have the information so that they don't have to be afraid of A, getting tested, and then B, don't be afraid of the results, because there are ways for us to help manage that virus. We certainly want people to know that we are in their corner and we are advocates for their health. Their health matters, and their health across the lifespan matters, and that their voice is extraordinarily important. It's okay to ask for what they need, and it's important for them to voice what they need, and we want to help them do that.